Hello, my name is Amanda Spinelli, and this is my presentation for medical terminology with instructor Summer Eklund, and I'm presenting on Alzheimer's disease. A little bit of background information for you. Alzheimer's disease is the most commonly diagnosed type of dementia and is a neurodegenerative disease. This means there's a progressive loss of structure and or function of the neurons. Nearly 2/3 of all Alzheimer's disease cases are women. Dementia is a slowly progressive decline in mental abilities, including memory, thinking, and judgment that is often accompanied by personality changes. It is not considered a normal part of aging, and it typically occurs after the age of 65, although it does on occasion occur earlier. The condition was first described in 1906 by Dr. Alois Alzheimer and is a continuum of symptoms that occurs in 3 stages. The first stage is considered early or mild Alzheimer's disease. The patient can still function independently on a daily basis, but begins to have difficulty planning and organizing. They struggle to remember words or tasks, and they begin to show signs of impaired judgment, along with a little bit of mood change and possible confusion with time and place. The next stage is considered the middle or moderate stage and is the longest stage. Generally, patients begin to require more assistance, keeping track of time, finding misplaced items, remembering when to take medications. You'll see symptoms become more pronounced and noticeable behavioral changes, maybe depression, anger, frustration, acting out. Memory loss begins to disrupt daily life, and they begin to have difficulty expressing thoughts. They have word confusion. They struggle to follow conversations. This often leads to a withdrawal from work and social activities. The final stage is stage 3, late or severe Alzheimer's disease. In the final stages of the disease, the patient can no longer function independently, and their body fails as the neurons die and the brain atrophies. They become unable to converse. Their body can no longer adapt to their environment. They can't do temperature regulation. They lose control of bodily functions, and they become vulnerable to opportunistic infections such as pneumonia. Alzheimer's disease is currently considered a multifactorial disease, and there is no known single cause. However, the most common theory currently is that for a wide variety of reasons, uh, amyloid beta or beta amyloid plaques are deposited and accrue in the brain. This occurs outside of the neurons, at the synaptic junctions and with the dendrites. This accrual and deposition leads to synaptic dysfunction and neuroinflammation when the microglia and the astrocyte cells respond to these depositions. Another cause, or thought to be cause, is the hyperphosphorylation of tau, which develops into neurofibrillary tangles or tau tangles, and those develop inside the body of the neuron and cause destruction from within the neuron itself. In general, Alzheimer's disease follows a general path of neuronal dysfunction, first affecting the neurons involved in memory, progressing to the neurons involved in language, reasoning, and social behavior, and finally widespread throughout the brain, causing damage and death to neurons all throughout the brain and widespread brain atrophy. Other contributing factors are thought to be vascular abnormalities, oxidative stress caused by free radicals, glutamate imbalances, mitochondrial disturbances, and the dysregulation of electrolytes such as calcium. Several risk factors contribute to the development of Alzheimer's disease, including age and gender, as mentioned previously. There are some genetic factors which are considered either risk factors or deterministic factors. Brain infections that occur earlier in life, multiple environmental factors such as pollution, other metabolic disorders such as obesity and diabetes, lifestyle like drinking, smoking, lack of sleep. Cardiovascular disease. Hypertension is actually believed to be a contributor. It can lead to microbleeds in the brain and cause damage to the surrounding tissues. Head injuries also can contribute. Concussions, subconcussive hits cause damage to the brain, which progresses throughout the years as we age and contributes to damage. There's quite a wide array of testing involved in this, largely non-intrusive, but quite in depth when it comes to the psychological testing. Medical testing first involves fluid biomarker tests, including checking for biomarkers in blood and cerebrospinal fluid. CFS is currently considered the definitive test on it, although a couple of blood tests are currently in research and being approved by the FDA. What they're looking for in these cases are tau proteins, beta amyloid proteins, and neurofilament light, or NFL. A lot of imaging is required. CTs are used to rule out brain bleeds. MRIs show a detailed picture of what's actually physically happening in the brain, or what the structure looks like. And a PET scan actually shows metabolic activity. As I mentioned, there are some genetic factors. Genetic testing is available. One of the considered risk genes is the APOE E4 gene. If you have this particular mutation to this gene, you are considered to be more likely to develop the disease. There are very few cases, less than 3% of those diagnosed, that actually have autosomal dominant disease. And this is just an inherited disease. There's nothing that they can do to change it. It just goes from parent to child in autosomal traits. Neurological exams are also conducted, such as the NIH stroke assessment. The psychological testing includes testing for depression using the Beck Depression Inventory and other patient-evaluated or self-evaluation tests. Cognitive, functional, and behavioral testing includes several different options. The ADA is a dementia screening test. SLUMS is the St. Louis University Mental Status Exam. Another couple common ones are the MMSE, which is called the Mini Mental State Exam. These are just a few. There's obviously other ones listed there. The FDA has also approved some computerized cognitive tests, where rather than having a person there asking you the questions, the computer is actually used to assess the patient's cognition and function. Here is just an example of some scans. This first one is an MRI scan. On the left is a normal, healthy brain. There's some normal atrophy there, and you see the hippocampus defined down there. On the right is an Alzheimer's disease brain. There's significantly more atrophy noted all throughout the brain. A PET scan is the second one. On the left, you see a normal PET scan, lots of red areas lit up where there's a lot of activity happening. MCI, or mild cognitive impairment, is sort of a pre-Alzheimer's stage. And you can see there's less red areas, there's a little more blue areas, not quite as much function happening there. And then last on the right is the Alzheimer's disease brain, where most of the middle of the brain is dead, is not functioning, and the outer layer of the brain, which is still alive, is significantly reduced in function. As far as diagnosis goes, it can only be made definitively post-mortem. There are a lot of current diagnoses made for Alzheimer's disease, and it occurs after a slew of the testing I mentioned before, as well as after obtaining personal and family medical history. But ultimately, the diagnosis is made at the neurologist's discretion. And the two really big sort of indicators are that fluid-based biomarker for cerebrospinal fluid and the diagnostic imaging of the MRI and the PET scan. But again, it can only definitively be diagnosed post-mortem. And a lot of patients that are diagnosed post-mortem are actually found to have what they're now calling mixed dementia, which is not just Alzheimer's, but a combination of various dementias. After the diagnosis has been made, treatment can begin. Unfortunately, there is currently no cure for Alzheimer's disease. Until recently, all approved treatments for Alzheimer's disease were actually only to treat the symptoms. As we age, the brain develops the brain has less acetylcholine available for synaptic transmission. So cholinesterase inhibitors are one of the first line of drugs. A common one is the donepezil or the Aricept. As you can see, there are a few other options available. What this does is it stops the reuptake of acetylcholine so that there's more of it available for the brain to use. The other medication currently available is N-methyl D-aspartate antagonist, NMDA for short. Currently, the only one available is memantine or Namenda. And what this does is it helps regulate glutamate, which ultimately reduces the overactivity of the NMDA receptors and helps to regulate calcium in the brain. Other than that, antidepressants, mood stabilizers, and, if absolutely necessary, antipsychotics are all also used for treating and managing the symptoms. Within the last 5 years, the FDA has actually approved the use of immunotherapy medications by IV and injection that are designed to slow the progression of the disease by binding and clearing the amyloid plaques. And these are, as I said, relatively new to their use, but are designed to slow the progression rather than just treat symptoms. One of the reasons that Alzheimer's disease is so hard to diagnose and manage is because the exact cause really isn't known. Approximately 55 million people worldwide are currently diagnosed with Alzheimer's disease, and that number is only projected to grow as more of the population ages. Currently, Alzheimer's disease is at the forefront of biomedical research. A couple of the current theories I've listed, there's a number of them, but I just picked sort of 3 of the ones that I find the most interesting. And the first one is the microbiome and the gut-brain axis. So the theory is that alterations in the microbiota of the gut, the bacteria available, all the various microbes in our guts are actually associated with the progression of dementia and Alzheimer's disease. It's not entirely understood how this happens, but the current theory is that it affects the immune response. So hopefully with manipulation of the gut microbiota, it can be a neuroprotective agent against tau tangles, and this can help slow the progression of the disease. And another very recent theory that I read about was that Alzheimer's disease is actually a result of a lithium deficiency in the brain. A study found that endogenous lithium is actually required in the brain to function, and that all of the dementia patients that they tested and none of the control test showed changes in lithium. So all the patients with dementia and Alzheimer's had decreased amounts of endogenous cortical lithium, and the control patients did not. Later tests on mice found that a 50% increase in amyloid beta deposition is associated with a decrease in lithium. So the theory is that they are trying to replacement lithium therapy by microdosing lithium, much smaller doses than are currently used to treat behavioral and psychological issues. And the theory is that this will prevent amyloid binding and the memory loss and pathological changes associated with it. Finally is the multi-pathology convergence to chronic neuronal stress. And this one basically says It could be anything. It is actually an accumulation of many things that are causing the disorder. Um, so included below are my works cited and the medical terminology. Thank you very much.